Hello, everybody. My name is Sushma. This is our Health and Nutrition Club, and we are going to do part 2 of dental issues. So the last time we did dental biofilms, we did fluoridation, we looked at how to take care of your dental health and amalgams and so on and so forth. And we're going to now talk about the most important thing in dental health, which is your diet. And nothing is more fun than looking at the Pottenger cat study done at the turn of the century by a doctor called Francis M. Pottenger. Back when doctors were doctors, they believed in curing patients, they believed in real research. And he did an amazing study on cats. He watched 10 generations of cats, 900 cats, and he gave them, and not just cats, but plants that were fed the excreta of the cats. And he gave them different types of food to see what the effect of the dietary was on these cats. And so these came to be called Pottenger's cats. And that's the illustration on top of a very tiny but a very decisive book in mine and a lot of other people's lives. So these things are not advertised. Like this guy is not gonna call you every 6 months and say, "Hey, get you a cleaning or your dental appointment." These are studies for you to seek out, read. This is a tiny book, and everyone should have it on their bookshelf. And in particular, you should read it to your children, your grandchildren, so they understand that good dental health is about food and not your teeth. If you want pearly whites, eat good food. And so what he looked at was, he did an experiment. He looked at, he actually worked with 900 cats, and his hypothesis was to test the effect of heat processed foods and vitamin D metabolized milk on the dentofacial structures of experimental animals. He was a fan of Weston A. Price. Heat labile factors necessary for the proper growth and development of cats. And cats, folks, are mammals, just like us. Clinical and experimental evidence of growth factors in raw milk, the influence of heat labile factors on nutrition in oral development and health. And so Weston A. Price came up with this research that people with good dental health and amazing dentofacial structures were people who drank raw milk, ate raw foods, did not eat sugary foods or condensed milk or the foods of modern commerce. And what did the raw milk and the raw meat contain that caused this to happen? That came afterwards. They called it vitamin A, D, K, and E, or whatever, or some other factors, or the Wilson factor for stiffness of joints. But the fact remains that in this feeding experiment, they had a couple of groups of cats. Okay, one group of cats got a diet of 2/3 raw meat, 1/3 raw milk, and cod liver oil, and the second group got 2/3 cooked meat, 1/3 raw milk and cod liver oil, and the third group got everything cooked, raw milk as well as meat. And he compared the facial structure, the fertility, the intergenerational health of these. So whatever you did or your children do is going to affect several generations down the road. So he actually looked at 9 generations of cats to see the effect of raw milk, raw meat versus cooked milk, cooked meat over several generations in these cats. And so then he took pictures and he dissected them. He did postmortems on the cats. And you can't quite see it very well, but I can in my book. So figure 2.1, which is the left-hand side picture, showed a cat that had been on a cooked meat diet for over 1 year. Okay, she has 6 kittens, 2 of which she eats on the very first day. She ate up her own kittens. She has no inclination to care for the remaining. She doesn't feel like feeding them, nursing them. Upon examination, it is found that she's unable to nurse her kittens because her mammary glands present no evidence of preparation for lactation. So what's going to happen to the next generation? They're either going to die or they're going to grow up very, very runty. The 4 kittens are placed on dropper feedings of cow's milk on the 2nd day. 3 die of diarrhea on the 3rd day. The 4th is placed with the lactating cat, the healthy cat showed in figure 2, but it dies on the 4th day in spite of every attempt on part of the foster mother to take care of it. In utero, they did not get good food. So on the left, you see a picture of the adult female cat, number 524. She's on cooked meat and raw meat milk for 6 months and during pregnancy. Note the dull eyes and the poor fur, and the 3 kittens die 4 days old. On the other hand, he looked at kitten, which is figure number 2.2, which is an adult female cat, 1 year old, who was on raw meat and raw milk. She has integrity of fur. Her organs, her internal organs are not soft, pappy, yellowed, bronzed, diseased. She has her first litter in pens in 1936. 4 kittens, 4 days old. They have full development and activity in the kittens. They have smooth luster of the fur. Their furs are shiny. There's one inactive kitten, okay? And that is the kitten belonging to the litter on the left, who was fed cooked milk and meat, cooked meat. She died. So in the second figure on your right, you see a raw food fed mother with her 4 kittens born the day before the ill-fated kittens on the left-hand side. The mother cat is 11 months old and has been fed raw meat, raw milk, and cod liver oil since the age of 2 months. She delivers 6 kittens, losing 2 on account of her failure to rupture the amniotic sac in time. So her sac didn't rupture, but the kittens that were delivered were beautiful. She has large mammary glands and has no difficulties in nursing her young. Her kittens have broad faces and show excellent skeletal development. So now the diet that our mothers ate and our grandmothers ate and our great-grandmothers ate become important. If we were born from the litter on the left, we're going to spend our lives trying to deal with our problems. If our mothers were raised on commercial foods of the modern ages, it's going to take the children a long time to get over those difficulties and 2-3 generations for them to recover from these problems. And nobody likes to hear that. There's always this thing, oh, you can do yes, you can do a lot. But understand that every action you take in this generation is going to affect future generations. And what they found with these cats were, even if they did manage to have, some of the cats managed to have kittens, and they in turn managed to have more kittens. The second generation was mangy. They were very irritable. They bit people around them. They were unfriendly, remind you of kids. And by the 3rd generation, they were sterile. So it's Darwinian. If you feed bad food to yourself and to your kids and your kids' kids, at some point, you just die out. Any questions so far? And the most important thing here is your dentofacial structure. Your mouth is what is needed it's the first place of digestion. If your teeth are not strong, your muscles are not strong, your jaws are not strong, what are you going to do? You're constantly going to have eating problems. What do you have when you have eating problems? You don't have food, you don't have nourishment. And so if you have dental issues, going to the dentist is the last thing you want to do. You want to shore up your health. Go drive 200 miles if you need to procure good raw milk, raw, high-fat, grass-fed Jersey milk, which is amazing for teeth, for children. My daughter is on raw milk formula, and not a sneeze, not a sniffle, not a cough, not a flu, not a cold. She's now what, 4.5, 5 months old, just growing like a weed. She's in the 99th percentile of children for her height. She coos and gurgles and doesn't cry, and just a happy baby. So food is important. What you feed yourself and your children is super important. And we all have to pay our mortgage. We all have to make a living. But the time you take to do some of these things, make your own ferments, make your own yogurts or beet kvases, or spend the extra dollar, think of it as your medicine budget, not your food budget, to buy grass-fed beef and eat it as raw as possible. Get one of those sous vide machines that barely cooks it. It's delicious. And so what he did was some variation, raw meat and cooked meat alternated. So what he was trying to emulate was, hey, everyone doesn't have the ability to eat raw meat all the time. Let me change up the diet a little bit. So he alternated raw meat and cooked meat, and he wrote down all his experimental results. In this experiment, one group of cats, is fed raw meat, previously fed raw meat. Then he puts them for 6 months on cooked meat, and then he returns them to the raw meat diet. And so what did the 6-month exposure to cooked food do? It corresponded with the human teenage years, when guess what teenagers do? Junk with Coca-Cola and Doritos. So when a female cat on this alternated diet becomes pregnant, her children, her kittens do exhibit deficiency symptoms, although she may appear to be in good health. So she got the good health. She ate crap in her teenage years. She had a kitten. The kitten has deficiency system. All of a sudden, you have a child. You had no asthma in your family, and this child has all sorts of chronic illness. So they do show some deficiency symptoms. Her succeeding litters show irregularities that tend to lessen in intensity for the first 2 or 3 years of her reproductive life and then increase again. So what they see is the first litter has some deficiencies, okay? And the next 2 or 3 years, they actually get better, but then they get worse again, the litters. But as long as her kittens get the optimum raw diet, their health improves. So there's hope. Even if your teenagers eats crap food, at some point, if they eat good food, and the children that they have that were born to unhealthy young women eat the raw diet, their health improves because the body is enormously plastic. However, when they are given cooked meat for a period of time, their resistance to disease greatly diminishes, only to improve when they are returned to the raw meat diet. So it doesn't stay. It doesn't keep like those who were raised and nourished in utero on raw meat and raw milk. These raw meat, cooked meat fed cats partially maintain their skeletal structure from generation to generation, but their calcification continues to diminish and their reproductive efficiency is injured from the standpoint of the size and vitality of their kittens and of the failure of their litters to conform to a homogeneous pattern. So you see one child that's supremely healthy, the next one is really unhealthy, the third one might be healthy. And you see that a lot in women who had ho-hum diets, and then they pick up after the first pregnancy. They may eat cod liver oil and raw milk and steaks every night. They have a good kid, and there's a drain on their resources on the next subsequent kids, and it has an effect on the reproductive efficiency of the future generations. So super important, not just that you eat right, but that you educate your next generations. Any questions so far? I mean, this is all pretty simple. It's pretty simple. If you think about it in the bit larger scheme of things, it's very cheap to get raw milk and raw meat and some cod liver oil and eat that in your daily diet. It's very simple to add enzymes and raw proteins to your diet, to add fat-soluble vitamins that are not destroyed by heat to your diet. And what this is going to do is remove dental problems, which is why it's part of this dental presentation.
I have a question. It's kind of the question of the what do I want to say? Transposing the history or the experience of cats to humans. I'm not saying that I'm not convinced, but I just want to know any words you might have about um, that so-called transposition.
Yes, the transposition to humans has been studied extensively by Weston A. Price. So what he did was, as you know, he looked at generations raised on their traditional nourishing diets, and then the foods of modern commerce, sugar, condensed milk, canned foods came in, and those same people within that generation destroyed their teeth, lost their teeth, and once you lose your teeth, everything in your digestion kind of goes down because you can't bite and chew and taste and so very much borne out by the work of Weston A. Price. And cats being a mammal, not everything might apply, but a lot of things would apply. Of course, there are rat experiments and cat experiments where you really cannot transpose. There's this guy who was doing immune therapy research. I forget Allison, I think his name was. Oh, I think he was nominated for a Nobel Prize. Maybe he got one. So he came up with this Keytruda immunotherapy that worked on rats to block the tumor generation and worked great. And so they did human trials and the humans died. So with drugs, there's a very big possibility that it will not work on human beings. Like it was like a 40% death rate. Remember the Nordstrom's guy who had cancer, took immunotherapy and died within the week? It is very dicey. But this is food we're talking about. This is food that we have studied over the ages. For centuries, our ancestors have eaten this way. And all of a sudden, we don't eat this way. Then we do, and you can see the effects on your diet right away. So, but that's a very good point. It's not necessary that what's good for cats is good for humans, but what's good for humans in that respect has been borne out by Weston A. Price's experiments.
Well, when I was in college studying to be a physical therapist, we had cat anatomy and human anatomy because the cat anatomy was very
Very
relevant.
similar, yeah.
Yeah.
Very, very similar. They have cycles, estrous cycles, same. And the reason he chose cats and not human beings, or of course you can't do human beings, but was he could study them within a 10-year period, and that functioned as a proxy for humans over several generations. And he drew some very, very important and kind of scary conclusions that it gives that we should heed. And so now he's looking at raw milk versus cooked milk feeding experiments. These experiments involve 4 groups of cats. One group gets a diet of 2/3 raw milk, 1/3 raw meat, and cod liver oil. So raw, raw, raw. The other group gets a diet of either 2/3 pasteurized milk, 2/3 evaporated milk, or 2/3 sweetened condensed milk plus raw meat. So they do get some raw meat. And then the third group gets everything raw, and the fourth group gets everything pasteurized and cooked, of course. And the results of this experiment, he said, correspond to those of the raw meat versus cooked meat experiment. No different. Animals on raw milk and raw meat reproduce homogeneous litters. So it's not like one kid is fantastic and the second kitten is mangy. They are homogeneously good litters. You will find in the indigenous cultures, they look like clones of each other. They all have facial structures, high cheekbones. They have teeth that are beautiful, dental arches that are broad. They're not raised on vegan foods. They're not raised with no fats in their diet. So their children are very homogeneously healthy, and the usual causes of death are old age and injuries suffered in fighting in these cats. They're generally healthy animals with normal anatomical measurements, so their organs are good and strong and robust, good resistant to disease, fur is not mangy, fur is of good quality with a very high sheen. And they show no signs of allergies. And let me tell you about an experiment close to home. as you know, I've been in and out of here because my daughter is in India. And so I've been spending time in Goa. And we have a dog who we love very much. He's 15 and a half years old now. His name is Travis. And 2 years ago, or 2.5 years ago, I stopped feeding him myself, and Richard took over and he said, I'll feed him. And I said, okay. And he started making food in bulk, and I said, okay. Then he said, okay, I'm going to just freeze it and then make portions for him and give it to him. And I said, okay. But the fatal thing he did was he started, and he wanted to give vegetables. I couldn't stop him. I would not have. But, you can't force people to do your bidding when you yourself are not doing it. At least he was getting food. So he was cooking the meats and cooking the vegetables and putting in a lot of sweet potato carbohydrates. And he was cooking the meat. Over a 2.5 year period, Travis was a very healthy fellow. His fur became mangy. He started scratching himself. He started getting lenticular sclerosis. So his eyes started developing, the cornea started developing opacities. He had ready infections. His mouth started stinking. He had halitosis breath. And he was still giving him turmeric and not cod liver oil, but eggshells and all that. But Travis's health was declining. And so I tried to make him read Pottenger's Cats, but he would not. And I said, look, the meat smells the same, looks the same, feels the same, but cooked meat is dead meat. And what he's getting is dead meat. For Christ's sakes, let's give our dog raw meat, and you can still do your cooked vegetables. Cut out the sweet potatoes because dogs don't do well in sugar. They don't have great pancreatic function. And he did that because he saw that he was declining. I kid you not. This dog did not have a spring in his step. He was tumbling around. Within 2 days of cod liver oil, turmeric, raw meat, and cooked vegetables that were non-starchy, his fur became shiny. It was falling out in great big clumps. His legs became strong. And the best thing was when we stood like 500 yards away from him, he came galloping towards us without stumbling, and he developed muscle mass. He had a suppurating thing on his thigh that disappeared and dried out. He had a little tumor on his ear flap that disappeared. And he just became and his eyes stopped watering. The sclerosis, I swear, has gone down. And so there's a vast difference, folks, between cooked meat and raw meat. That's all I'm trying to say. Cooked meat and raw meat have vastly different characteristics. When you eat raw meat, it digests itself. It has proteases, the enzymes that allow. If you eat highly cooked meat, you'll find that you're not able to eat more than maybe 3 or 4 ounces. It sits like a stone in your belly. Whereas raw meat, you can eat a ton of just raw fish or chicken, bite into a chicken thigh. Sounds gross, doesn't it? But you can do it for the sake of your dentofacial health.
May I ask a question?
Yes.
I was at the store and I was able to buy some wild caught salmon, but I bought the skeletons and the head and the collars and so on. And there was so much flesh on it. And I salted it. And then I did not leave it out in the refrigerator. I just put it in a bowl and I ate it like 3 days in a row. Now, should I have let it be in the salt for more than one day before eating it? Or
No, you can eat it straight. You can eat it in salt. You can eat it with any condiment so long as you don't cook it.
okay, because the reason I say that is, you keep hearing, well, for sushi, you need special fish, it needs certain quality. And I just wondered, when I'm getting this regular wild caught at the store,
Someone's loss is your treasure, sunshine.
okay.
And that is what you want to keep in mind. People don't want organ meats, they don't want skeletons and carcass. And then you eat the meat and you throw the rest in to make fish soup.
That's what I did. I made a really great fish soup. So
Fantastic.
it was fantastic. And there was so much fat So I was getting good fat with the fish because the part near the skin was so
Mhm.
fatty.
Oh, yeah. And the skin of fresh salmon, oh, so yummy. Yummy.
Okay.
Yes. Salmon is always caught, frozen, and then thawed in a store, but that's still better than eating cooked salmon.
Okay. Thank you.
Excuse
And
me,
mhm,
I thought that this is Lotta.
mhm.
I thought that inside the skin of the salmon you could have I think it's trichinosis, or is it the worm?
You could. There could be worms in the raw meat, raw chicken, raw salmon, which is why you have to be very vigilant to it. If you look at the meat, it has to have the right color, the right sheen, but
Mhm.
but in a healthy animal, you're not going to have those things. So be very observant. Like Richard brings home rock, which frequently has worms in it. So we just cut out the worms and eat around it raw.
Yeah, I think that's why in the sushi restaurants they cut off the skin and they make salmon skin rolls with it, but they heat it up.
Right, right. And they can do it, and they have a liability issue. You don't. So take a look at the salmon, take a look at the skin. If it looks healthy, um, by all means eat the skin, or you can lightly crisp it up. Crisp salmon skins are still very good sources of collagen, of the skin tissue, and eat it with, I like to eat it with a little paprika and some sea salt. It's so good. But as much as possible, try and eat raw. Um, Chicken, if you cannot afford salmon, if you can't find decent meat, I have seen people who eat chicken really, really thrive. Just bite into it. It's like fish. It's just a mental block we have to eating chicken. But try and find chickens that are pasture raised, please, not industrial chickens.
And I was going to say with the salmon at the grocery store that I go to, I get the wild caught salmon, head and skeleton, and it's like $2.59 a pound. Whereas if I went and bought a slice of salmon, it would be $28 a pound.
$30 a pound. Yep, yep. And you can take the eyes out, and the eyes are a special delicacy.
Yes.
Yeah, they're delicious. And there's salmon skin or flesh around the cheeks that is delicious. So yeah, yeah. By all means, go and grass-fed beef. It's fantastic. If you need a snack or get a stick of raw butter and just eat raw butter, it's raw. So all the heat labile factors, which is the A, D, K, and E, the heat fat soluble vitamins are alive, and you'll have very good health.
I
All
have a
right.
question.
Mm-hmm.
To get raw meat, like where do you go and shop? Like you go to the butcher's place, or because otherwise there is stores,
Yeah,
they sell
you
the
go,
meat.
stores usually get unfrozen meat in the butcher's area. It's not frozen. Or you can buy like half a cow, but then you're going to freeze it. And freezing kills off some of the enzymes, but it's still pretty good. You can eat it raw, or very lightly cooked if you can't stand raw. But
So it shouldn't be from the mall, or the mart where they keep it in the frozen section. This
yes,
should be,
yeah,
because
fresh.
it should be fresh, so we should be able to see what the
Yeah.
butcher is
Yeah,
selling
and
on that
ask the
particular
butcher,
day.
is this fresh or is this frozen and then thawed? And the butcher is required to have fresh, never frozen meat. It tastes very different, fresh, which has been aged for 30. So what they do is they'll take that animal, they'll hang it up for 30 days. So it's tenderized, it's lacto-fermented, and then they'll sell it as, aged beef or aged lamb or goat. And it's very delicious. And there's this fear because we started refrigerating stuff of keeping meats and having them spoil. And I assure you, rotten meats are not poisonous meats if they are aired properly, kept in, or you can, if you're afraid, you can put them in a refrigerator in a jar, and then they get pulpier over time, but they're very digestible and they have an enormous number of enzymes, metabolites that you need, fat and water soluble vitamins, and the proteins are amazingly easy to digest. And you just feel good afterwards. You develop muscles without actually exercising. You sleep better, hair quality becomes better. All of these, when your hair falls out, that's a function of your diet. All right, so these were the 4 groups of cats. And the results of the experiments correspond exactly to the raw versus cooked. The cats fed pasteurized milk as the principal item of their diet show skeletal changes, lessened reproductive efficiency, and their kittens present progressive constitutional and respiratory problems, as is evident in the first, second, and third. And he went all the way to 3, 4 generations, and that's a very important study, because what happens in modern pharmaceutical analysis or clinical research? They do rats for like 20 days. Rats live for 2 years. And they say, oh, in 90 days, the Roundup fed rat didn't die, so Roundup is safe. After 2 years, they develop mammary tumors. Their intestines are destroyed, the livers are destroyed, but they're selling Roundup. So this guy studied cats for several generations. Cats fed evaporated milk show more damage than their pasteurized counterparts, while the most marked deficiencies occur amongst those fed sweetened condensed milk. Back when the turn of the century, they had excess milk and canning was developed, and lo and behold, people started drinking canned milk because it was so much more shelf-stable, so much more transportable, and a lot of the indigenous people were fed this by, the Western countries who thought they were doing them a great service and being very charitable and giving them condensed milk cans, which pretty much killed them. Sugar plantations. These people were eating sugarcane all the time and had excellent dental health until they started getting a ration of their own sugar on their sugar plantations. The natives got sick and died. The cats on sweetened condensed milk develop much heavier fat deposit and exhibit severe other problems. Severe skeleton deformities. You're doing it from childhood, you're going to have huge problems. They show extreme irritability and pace back and forth in their pens nervously. Table 1 reveals the effect of condensed milk, evaporated milk, pasteurized milk, and metabolized vitamin D milk on the lifespan of these specific experimental animals. And look at the difference. Condensed milk, 9.5 months, 7.5 months, 7.5, female and male, number and order, age of experiment, in an adult 1 year, 7 months, evaporated milk, same thing. And then there's data to show that plain milk, raw milk, they lived the longest. In the development and longevity of cats fed 1/3 enough raw meat to maintain them and 2/3 amount of food from milk. Note that the animals on the metabolized vitamin D diet died within 2 months. They died within 2 months. While most litter mates survived the entire experiment. Start of experiment was December 12, 1940. And I encourage you to get the book and read it. And the last thing I wanted to come to was, not only is this affecting us and our future generations, it's affecting our plants, because we poop into the environment. That stuff goes and nourishes plants. And what they show is beans that were harvested from plants grown in plots, fertilized by the composted cat manure. What did they see? The raw meat beans. Okay, number 3 here is raw meat. Number 1 is pasteurized milk beans, which is, if you can see my arrow, this is the pasteurized milk beans. Number 2 is certified milk beans. Number 3 is the raw meat beans. See how much more homogeneous their shape and structure is. They're heavier in weight. Number 4 is cooked meat beans, mangy. They're all over the place. Some beans are big, some beans are tiny. There are fewer of them. They're lower in weight. And number 5 is the no fertilizer beans. These are not given any of the stuff. They're sort of run of the mill. But the best beans are the ones that were fed raw meat compost. The cooked meat in this group, 1/4, so the raw meat beans, they have a hard white surface. This is the harder white surface. Uniformity of size and plumpness of the beans distinguishes them from the beans of all other groups. So you can tell them apart from the other groups of beans in the 5 groups. The cooked meat in this group, 1/4 of the beans are shriveled, which is number 4. These are the number 4 beans, cooked meat beans. 1/4 of the beans are shriveled and yellow in color. You don't see that because it's a black and white photo. The remainder are smooth and white. They also are more plump than the milk beans, but they're not as plump as the raw meat beans. They exhibit peculiar oblong shape of the milk, so they're not their best version. Pasteurized milk beans have a hard, smooth, white surface. The most noticeable feature are their flatness and oblong. So they're flat. So their reproductive capacity is also affected, folks, of the beans. Certified raw milk, these beans exhibit the same general features as those of the pasteurized. So they didn't do too well either.
So I have a question about raw meat, and
Yeah.
by extension, I'm talking about bones. For a long time, I had good sources of pasture-raised bones. Right now, those sources seem to have disappeared. I'm still searching for them. So I'm wondering if I get, or anyone gets bones from ruminants, from cows, let's say, and they are from non-pastured animals, what difference might there be between those and those that go from pastured animals?
Your safest best bet is ruminants, because ruminants are largely, especially in the farms, if you get them from a reliable source, largely on pasture. They go to the slaughterhouse the last couple of months, or they get fed grain the last few months of their life. But your best bet is to get it from ruminants that are not grown in factory farms, and they will say grass-fed or largely grass-fed bones. And or wait, I'm doing a herd share. I'm doing a meat share in the next 2-3 months, and there will be bones. But in the meantime, you don't want to wait. So Terra Firma Farm has bones. There are many farmers that sell the animals bones and meat, and you can choose to get the bones. And you can tell them, just put the bones in a bucket for me, and I'll do my freezing myself. And you just put it in plastic bags and put it away in your freezer. But you can do a whole animal, you can do a whole lamb, and that way you'll have bones. Ask them for the head as well. Head makes the most amazing stock, and head cheese, which is the brain. You can
Pig's
scramble
feet.
it like eggs.
Oh, pig's feet are fabulous.
Yes, trotters, yes.
Trotters,
Fantastic.
yeah.
Of
And
nice pasture pigs.
Terra Firma Farms is the place I used to go and bring back bones for land. And they're much less expensive than, going into a market for it.
There you go.
And they're
Cajole sunshine into this. On my way to and fro, ask me and I'll get you bones too.
Okay, thank you.
Both of you,
It's
yes.
not very far from here.
Thank you.
Not far. Any other questions?
What about the water?
Water is
And
very
I say that because last week, my neighbor in the art studio said, Sunshine, when are we gonna go for water? I've got to find out where the spring is. So he drove me and him to the spring, and we got water, and I brought some here for land, so he'll get to taste it too. But my neighbor said it's so incredibly, so much better than even the filtered waters, from the taps,
yes.
that he just feels it in his body. So I wonder, what do the animals do? I mean, if there's a creek, is it contaminated, or where do they get their water?
Animals cannot drink fluoridated water. They will die. So a lot of these animals have spring water on their farms or well water, which is still better. Yeah, it's contaminated a little bit with the Roundup runoff and arsenic, but by and large, these animals drink good water. The lady who was doing horses, her horses were drinking spring water before, and then they started drinking fluoridated water and died en masse, stopped reproducing because the bone marrow just fills up with fluoride crystals. So, and animals have a large requirement for water. You cannot give them chlorinated, fluoridated water. They will die. So yes, please. And the spring water, well water, no comparison. You know, people say Berkey filters out fluoride ions. Baloney. I don't believe that one moment.
I
Yeah, it
heard that
cleans
it
it up.
doesn't.
Yeah.
I heard it doesn't.
Yeah, yeah. So if you're misleading yourself on that, just but drink what you can, but try and ameliorate it with other good food. I mean, people living in cities gotta drink fluoridated, chlorinated water until RFK's message gets heard in San Francisco. But in the meantime, we can all drink spring water or figure out ways to drink good
And the
water.
thing is, we all need to speak up and support him in his effort to get rid of the fluoride. Everybody has to speak up. I mean,
So
I remember years ago going to the Marin Municipal Water District meeting. And we
yes,
all spoke to get the fluoride out. Only one person spoke for fluoride, and it was a almost unanimous vote of the group
supervisors, yeah.
of the supervisors
Mhm.
to keep the fluoride in, but they get paid for it.
Yeah, yeah. And in a 1 decade period, Marin had the highest fluoride levels. They accidentally put in too much fluoride for many, many years. They have the highest breast cancer rate in the whole nation. I mean, it's just a criminal. What they're doing is criminal.
Yes.
Yeah. So get your own spring water, guys. Find good sources of water. But the key thing here is raw animal, raw vegetables in an easily digestible form. And what I'm going to do is I'm going to stop the recording and then we'll go to Q&A. Thank you very much. This is key and primary in your dental health, understanding Price Pottenger's research and applying it in your life. Thank you so much.